1. When teaching Fundamentals of Laparoscopic Surgery (FLS) skills to adult learners, which approach best supports self-directed learning? A. Providing lengthy lectures without hands-on practice. B. Encouraging learners to set their own performance goals with guided feedback. C. Assigning identical tasks with no room for adjustment. D. Limiting opportunities for reflective practice. 2. During an FLS curriculum evaluation, what is the most reliable method to assess psychomotor skill acquisition? A. Multiple choice quizzes. E. Peer-to-peer oral questioning. C. Objective structured assessment with task-specific checklists. D. Group discussion reports. 3. In mentoring a resident through FLS tasks, which communication strategy fosters psychological safety? A. Critiquing errors publicly in front of peers. B. Providing vague, non-specific praise. C. Delivering constructive feedback privately and respectfully. D. Allowing mistakes to accumulate without intervention. 4. Which regulatory requirement most directly affects the integration of FLS certification into surgical training programs? A. Federal financial aid eligibility. B. Accreditation Council for Graduate Medical Education, ACGME standards. C. National Board of Medical Examiners, NBME question banks. D. Hospital marketing strategies. 5. In curriculum development for FLS training, which element ensures alignment with competency-based education? A. Including only knowledge-based written exams. B. Developing objectives tied to measurable surgical outcomes. C. Prioritizing student satisfaction surveys exclusively. D. Relying solely on instructor intuition. 6. A key adult learning principle applied to FLS training is: A. Learners thrive on passive listening. E. Learners require context and relevance to apply skills effectively. C. Learners prefer one-size-fits-all standardized pacing. D. Learners reject reflection and feedback. 7. When assessing FLS proficiency, which evaluation method reduces subjectivity? A. Global impression rating by a single instructor. B. Standardized metrics such as time to completion and error count. C. Narrative reflections written by learners. D. Informal peer review sessions. 8. Which mentoring technique is most effective in fostering long-term laparoscopic skill retention? A. Emphasizing performance speed over precision. B. Encouraging repeated deliberate practice with feedback loops. C. Assigning unrelated tasks for variety. D. Minimizing feedback to encourage autonomy. 9. Instructors developing FLS assessments should prioritize which principle to ensure fairness? A. Aligning test items with clearly stated learning objectives. Using subjective language to test adaptability. C. Designing items unrelated to core surgical competencies. D. Allowing unlimited attempts without standards. 10. Effective communication during FLS feedback should emphasize: A. Criticism without guidance. B. Timely, specific, and actionable recommendations. C. General statements of disapproval. D. Ignoring learner input. 11. When revising an FLS curriculum, the most important step to confirm effectiveness is: A. Reviewing anecdotal learner comments only. B. Conducting systematic program evaluation with outcome data. C. Maintaining outdated modules for consistency. D. Eliminating psychomotor assessments. 12. Which adult learning strategy best promotes engagement in FLS training sessions? A. Passive video viewing without interaction. B. Hands-on skill practice with immediate application. C. Memorization of lecture slides. D. Isolated individual reading assignments. 13. In designing FLS skill stations, which evaluation method ensures standardization across learners? A. Instructor's subjective judgment. B. Norm-referenced scoring rubrics. C. Criterion reference checklists with clear benchmarks. D. Group consensus scoring. 14. Which of the following best exemplifies regulatory compliance in FLS testing? A. Adhering to nationally established testing protocols and security standards. B. Allowing instructors to alter exam content freely. C. Ignoring confidentiality requirements. D. Designing assessments without external oversight. 15. The most effective mentoring technique for novice laparoscopic learners is A. Modeling correct performance followed by guided practice. B. Assigning advanced tasks immediately without demonstration. C. Withholding corrective feedback until the final exam. D. Encouraging competition over collaboration. 16. Which component of curriculum development ensures FLS training addresses learner needs? A. Needs assessment before instructional design. B. Random selection of training modules. C. Following only faculty preference. D. Eliminating learner feedback. 17. When conducting formative assessments in FLS, the primary purpose is to A. Grade final learner outcomes. B. Provide ongoing feedback for skill improvement. C. Replace summative evaluations. D. Eliminate the need for practice sessions. 18. Which adult learning principle is most relevant when designing FLS training for experienced surgeons? A. Emphasizing rote memorization of basic skills. B. Acknowledging prior experience and focusing on advanced applications. C. Treating them identically to medical students. D. Avoiding context-based scenarios. 19. A reliable FLS evaluation system should A. Depend entirely on learner self-assessment. B. Include objective scoring criteria with inter-rater reliability. C. Prioritize speed over error tracking. D. Vary by instructor preference. 20. In providing feedback to FLS learners, the feedback sandwich approach involves A. Delivering only negative comments. B. Mixing positive reinforcement with constructive critique. C. Withholding all feedback until course completion. D. Substituting peer evaluations for faculty input. 21. Which mentoring practice best supports continuous improvement in laparoscopic skill development? A. Encouraging reflection after each practice session. B. Allowing learners to work without debriefing. C. Criticizing errors without context. D. Providing only summative evaluation at the end. 22. Which aspect of communication is critical during FLS training to prevent misinterpretation? A. Using precise, standardized terminology. B. Relying on vague hand gestures. C. Avoiding eye contact with learners. D. Excluding learner questions. 23. When designing an FLS assessment rubric, which factor is essential? A. Alignment with validated psychomotor skill standards. B. Faculty convenience in grading. C. Avoidance of measurable outcomes. D. Inclusion of unrelated theoretical content. 24. In regulatory compliance, which consideration is most relevant to FLS exam administration? A. Test security and integrity of score reporting. B. Reducing the number of proctors to save costs. C. Allowing learners to collaborate during exams. D. Posting correct answers before exam completion. 25. To maximize skill transfer from FLS to the operating room, instructors should A. Design simulations closely resembling real surgical tasks. B. Use only abstract, non-contextualized exercises. C. Focus exclusively on theoretical lectures. D. Assign irrelevant physical tasks for dexterity. 26. Which evaluation method is most appropriate for measuring higher-order laparoscopic decision-making? A. Multiple-choice knowledge tests. B. Simulation-based scenarios with branching outcomes. C. Simple checklists of task completion. D. Peer popularity surveys. 27. In mentoring FLS learners, scaffolding involves A. Gradually reducing instructor support as competence increases. B. Allowing learners complete independence from the start. C. Keeping support constant, regardless of progress. D. Refraining from providing demonstrations. 28. Which communication barrier most hinders effective FLS instruction? A. Failure to adapt explanations to learner experience level. B. Use of standardized anatomical models. C. Clear alignment of objectives and methods. D. Delivery of structured performance feedback. 29. When designing an FLS curriculum, which principle ensures inclusivity? A. Providing varied teaching strategies for diverse learning styles. E. Using only written materials. C. Limiting resources to a single type of learner. D. Ignoring learner diversity. 30. Which outcome measure best demonstrates mastery of FLS psychomotor skills? A. Self-reported confidence levels. B. Time efficiency and error minimization in standardized tasks. C. General attendance records. D. Oral presentations on surgical theory.